Hi, my name is Vedula, and we will be presenting our poster for the CMI 22 conference titled Combining Image Similarity and Predictive AI Models to Decrease Subjectivity in Thyroid Nodule Diagnosis and Improve Malignancy Prediction. Thyroid nodules are a very common problem, with up to 67% of older adults harboring thyroid nodules. The current classification systems for thyroid nodules are very subjective, with the most definitive way to exclude thyroid cancer is through invasive procedures, such as fine needle aspirations or through surgery. This creates significant emotional burden to the patient and contributes to rising healthcare costs. Therefore, there exists a need for non-invasive objective classification. One such method to decrease subjectivity in medical imaging interpretation is through AI algorithms. Some thyroid cancers appear benign on ultrasonography, so an AI algorithm using image similarity rather than image classification was used to generate a diagnosis. A thyroid's prediction algorithm was also used to generate descriptors that are understandable by humans. This is unique as image similarity and predictive models have not been combined before for thyroid nodules, and it provides explanations for the decisions made by the algorithm that are verifiable by humans. This image depicts the TIRADS algorithm that is currently used to predict malignancy risk in thyroid nodules. It predicts this risk based on 5 categories, which are the composition, echogenicity, shape, margin, and echogenic foci of the thyroid nodules. This is then translated into a system of scores ranging from TIRADS 1, which is benign, all the way to TIRADS 5, which is highly suspicious.
So for materials and methods, we received ultrasound images of 192 biopsy-confirmed thyroid nodules between April 2017 to May 2018. And these were all obtained from a Stanford dataset that is publicly available. We used these to determine how effective artificial intelligence would be in predicting malignancy as well as developing a TIRADS recommendation. So we used the images with the largest nodule area, and then the AI algorithm examined those regions of interest and compared them to similar images to predict whether or not there was a malignancy risk of the thyroid nodule. And then using a CNN, it also produced descriptions and TIRADS scores. So here we have an example of the software being used. So up top we have an image with the region of interest. Then a diagnosis is created based on a similar image, and in this case the diagnosis is benign. And TIRADS description and recommendation is also produced based off of composition, echogenicity, shape, margin, and echogenic foci. The recommendation is TIRADS 2. In this case, it's non-suspicious and no biopsy is needed. So there was an 8.85% prevalence of malignancy risk. So out of the 192 thyroid nodules, there were 17 malignant nodules and 175 benign nodules. And importantly, our AI algorithm did not miss any cases of cancer. It predicted malignancies with a sensitivity of 1 and a specificity of 0.55. The positive predictive value was 0.18 and the negative predictive value was 1. And the AU-ROC was 0.78 with a likely confidence interval between 0.68 and 0.87. And then finally, TIRADS-based clinical recommendations had a polychoric correlation of 0.67. Ultimately, we determined that our model could accurately predict histopathological malignancies, and therefore decrease the need for biopsy in 50.5% of the nodules. So what is the impact of this? Well, as we mentioned, the current classification systems have many problems, such as subjectivity, the use of invasive procedures, and rising healthcare costs. However, with our AI algorithm, by combining image similarity and predictive models, it offers a non-invasive strategy to decrease subjectivity, reduce unnecessary biopsies, and thereby reducing healthcare spending. Thank you.